Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. And welcome to today's special episode of Patient Journey Pioneers, where our main focus will be on the upcoming Healthcare Internet Conference, aka HCIC, taking place this November in LA, the premier conference for healthcare marketers and digital leaders presented by Greystone. Hyro is also a sponsor, and we're exhibiting there, and we're excited to see what's going on this year. And to get some inside scoop and insights, I'm honored to welcome Mike Schneider, Principal and Senior Executive at Greystone Net. He's been helping hospitals and healthcare systems navigate marketing and digital strategy for over 25 years. Hi, Mike.
Hi, good morning.
It's great to have you, and I don't want to steal your thunder more than I already have, so let's start with you sharing a bit about yourself, your role at Greystone, and how Greystone operates as an organization. Then we'll get into HCIC.
Sure, that sounds great. So, thank you for the introduction and thanks for having me today. And I'm excited to talk about HCIC. And, as time goes on, I can't believe how long I've been in this industry because I don't feel as old as I'm going to sound. But I started working at Greystone in 1996. That's when we kind of started the company. And my role previous to that was working in hospitals and healthcare systems in marketing and marketing strategy, marketing research, and it was exciting to me. And during that time, a lot like today, what we were trying to do is we were trying to identify ways to get the right messages to patients and families and related to patient care, trying to make sure that folks had a good understanding of what the hospital experience was going to be like. And lo and behold, kind of the internet came along. And, it's hard to believe, I think, especially for younger folks who have never experienced a world without the internet. But that was a pretty big time. It just, I was thinking about this today. It's a lot like the questions that are coming up today about AI. People said, well, how is the internet going to change healthcare? And so in our practice at Greystone, that has kind of been our role for the last 27 or 28 years. And that is that we work with hospital and healthcare system marketing, communications, and senior level leadership to think about how to use digital technology in the best possible way as it evolves, because there isn't a roadmap that already exists. It's as new things happen, how do we adapt the way that we're using our marketing and leveraging our strategy skills to utilize that kind of technology. And that's really the premise of HCIC, the Healthcare Internet Conference. It feels very archaic to say Internet Conference because it's a digital world, but we started that way. And it's got name recognition, obviously. And so over time, what we've done is with this conference, brought people together in a networking environment to allow them to share stories about how they're leveraging the latest technology, digital technology. Depending on what year it is, it's very different. But the whole point is that, it's an opportunity for those folks to get together and share with each other and learn a little bit from each other about what's working, what's not working, where the road bumps are, and what we have to do within our own organizations to do the best job of leveraging that technology.
Wow, I feel like, first of all, I want to know, what year is this of HCIC?
Yeah. This is the 27th annual conference.
Wow.
Hard to believe, yeah.
I'm wondering what topics you guys covered year 2 and year 3.
Oh my gosh. I could tell you it's something I'm not sure everybody wants to hear this story, but it's amazing. Back in those days, and I'm not kidding when I tell this story, we would have doctors show up and bring their sons and daughters and say, my son knows how to use the internet, and so I brought him, he's 20 years old or whatever, and he's helping us design our first website. And no kidding, that was kind of where we were with all of this. What kind of content do you put on the web? Do we scan our brochure and then make hot links and create a website from that, or should we be writing unique content for our website that's different from our brochure? So, I could go on, but it's amazing. And as you can imagine, the other thing that was crazy was the platform that we had to be able to do some of that. So back in those days, it was dial-up. So I literally would be working from an airport plugged into a payphone, using my laptop to build web pages. It was crazy. But it's,
Wow.
reflective of how things changed pretty quickly over time and how our technology has really, it's just been 25 years or so since it became kind of mainstream to leverage digital to
Right.
communicate.
Wow. I mean, those were the good days. I wish we could all go back
Oh,
to that. But,
it was fun. It
and
was fun.
it's definitely a race to keep up with all the trends going on, and specifically in digital healthcare with all the policies in place and ethical considerations. It's not like any other industry, so you're really on the forefront of that. And it's amazing to see how things have evolved over the years. So today we're dealing with generative AI, ChatGPT, automation, patient digital demands. What are the top trends that we should expect to see at HCIC that attendees should be aware of this year?
Well, you hit on quite a few of them. I mean, I think it is generative AI and I think it is Chat GPT. But, it's interesting. We are also facing kind of the evolution of a lot of things that have been here for a while. So, for example, recruiting, retaining, and engaging job seekers. That's a target audience for healthcare systems and it's competitive. And now you've got a situation where a lot of folks are working from home all the time or part-time and you're competing with organizations that are willing to offer those kinds of things. So that's actually, a topic that we're going to talk about in some of our master classes to help organizations when they're doing recruiting to kind of figure some of that stuff out. One of our topics is related to differentiation. And, in the world that we live in today, how do you stand out compared to other organizations in your marketplace? How do you create a unique user experience or visitor experience or patient experience? One of the biggest things that's happened, I think, in the last I would say it's been several years, but it really seems to be hitting hard right now, is everything related to patient privacy. What can we collect as providers? What should we collect? How can we use that information? There's some amazing topics there and amazing case studies of organizations that have just been rattled and turned upside down with privacy breaches and issues that they've had to deal with and how they've tried to recover from some of that. So that's one of the topics that we'll have. One of the things that we deal with as an industry, and this has been going on since we started the conference in 1996, is how does marketing work together with the other senior level leadership areas and pillars within the organization? So how do we work together well with IT? How do we work together well with the communications team, with HR, with the patient care team? And so, again, I think we'll have a lot of presentations about that, and a lot of case studies about how organizations are kind of working through some of those things. And that's just the tip of the iceberg. There are tons of other areas as well, but those are some of the hot ones that pop into my brain.
Yeah, even Hyro actually, we're delivering a session on AI and automation and with the difference between chatbots, and so that whole area is getting a lot of attention this year.
Very
And we're
much.
excited. Yeah. So when you put together the agenda, which healthcare systems are you reaching out to? How do you go about recruiting the speakers? Who should we expect to see at HCIC this year?
That's a super good question. It's funny because I think it's kind of a hybrid model. We have a call for speakers that goes out in January every year, and we really have it open. It's an open call. So, we ask vendors, we ask providers. We like to have provider-driven sessions. So a lot of times it's a provider and a vendor together sharing a topic. And then when we try to fill the agenda, our goal, and it has been since the beginning of the conference, since we've been doing this conference, is to have a real range of content. So we want to have high-level organizations on our agenda, so Cleveland Clinic and Mayo and some of the larger Johns Hopkins, and they're going to be there, and they're going to be presenting.
Our friend Edward Marks is also, he told me about this conference actually, so he's a good friend, and we'll see him there.
We're super excited to have him. Super excited to have him. But then we also try to make sure that we have content and sessions for folks who aspire to be like those organizations, but know that they're at a certain range. And we want them to be able to have peers to talk to and learn from, so that if you've got budget constraints or you've got resource constraints, how do you make the most of that situation as well? So you want to learn from the best, and you want to know what's going on out there with those organizations that are, flush with resources, so to speak. But on the other hand, you as a smaller organization, you also want to know how to be nimble and work in the marketplace as well.
So, okay, there's a lot going on, and I feel like I want to write down like 10 different sessions at every given moment. So how can attendees make the most out of these educational sessions? Are they happening simultaneously or recorded, or what's going on with that?
Yeah, it's tough. And I mean, even as a conference organizer, I have a very difficult time figuring out how to get to the sessions that I want to see. Because a lot of times there are two or three sessions going on at the same time that are all equally interesting. So, I mean, my first suggestion is to make sure that you have the app and make sure that you also have a copy of the brochure. This is what I do in my old school sort of way: is I print out a copy of the brochure, which is available on the HCIC website. It's hcic.net, and then I go through and I try and identify the sessions that I know I can make it to. We are recording the sessions and they will be available afterwards. It's not a video recording, so it'll be an audio recording, but those audio recordings will be available after the conference.
Okay, amazing, cool. So that's a great way to kind of maximize our time at HCIC. And vendors, how many vendors do you guys have this year? What is the diverse collection of vendors?
Yeah, we have a really nice every year. We I think this is one of the good things about HCIC. We have a very large and nice exhibit hall with an opportunity to go and visit vendors that are kind of all over the board. I mean, it's everyone, as you can imagine. It all different disciplines: content management systems, CRM, AI, consultants, writers, you name it. And so within the exhibit hall, there will be exhibit hall sessions where attendees can go through and they can spend some time with each of the exhibitors and learn a little bit about what they do. If they're looking for something specific, in advance, we publish the list of the vendors who are going to be in the exhibit hall. And so you have an opportunity to kind of map that out too, just like you might your schedule, and think about who do you want to go see and who do you want to spend time with, and maybe even connect with them ahead of time. But it's a wide array, and we're somewhere in the neighborhood of 80 vendors that attend and participate in the exhibit hall. But there are more vendors than that actually participate in the conference. So, if you go through the agenda, you'll also find that there are other vendors who are on the list who may or may not be in the exhibit hall.
Got you. Okay, so 80 vendors, but the number everyone should remember is 21 because that's Hyro's booth.
That's right.
Yep,
Absolutely.
no pressure, but definitely come by. This year we're bringing our famous monkeys. They're flying, screaming monkeys. So Mike, I'll have one set aside for you, but definitely come by and say hi to the team. So
Super
Mike,
excited.
Yeah. So before I move on to kind of future outlook and how you stay up to date with information and put together the most cutting edge conference, how do you stay up to date? Like, what do you read? What do you consume?
That's a great question. It's for me, and this is just how I process. It's primarily about networking. I mean, we have a team of folks at Greystone, and we all digest a variety of different things. So we attend industry conferences. I mean, we've been to Shushmit, and we've been to the Forum for Healthcare Strategy and Marketing, which is a big conference that happens in the spring. And so at those conferences, we're seeing other speakers and presenters and learning about topics. But just like everyone else, we're also watching podcasts, reading newsletters, digesting information that is online through LinkedIn. We network and spend a lot of time with other vendors. One of the things that we do at Greystone is we actually work together with vendors and put together podcasts of our own and webinars. And so I learn a lot through those every year. We also do independent market research at Greystone. So we do a little bit of research about what folks are doing within the industry. So that's my long way of saying it's a stew. It's a little bit of everything kind of thrown into the pot to try and get as much as we can from a variety of different angles.
Got you. Okay. And now before we delve into the future, I want to know from an expert like yourself, what is the biggest pain point 2023/2024? What is the biggest pain point on the table for healthcare marketers, digital leaders, strategists that you're seeing?
That's a really good question. Okay, so I'm going to answer that because I think there are really a couple of answers there. One is the stock answer. I think I've said it for years, but I just always feel like when we're working with hospitals and healthcare systems in the realm of marketing and digital, most folks are working at a deficit when it comes to resources. So that's budgetary resources, and I think especially in the last year, it's been very difficult. And then also human resources. I mean, I feel like we've always kind of operated at a deficit, and then after COVID, it feels like we lost some really great people who were in the industry who moved on to other things. So, I think there's always an opportunity to kind of grow that a little bit for each hospital and healthcare system, but I think the deficit of resources makes it very difficult, because what we have is an environment where it's not just changing in terms of the target audiences and what they need to know to become patients or to convert, but it's also changing technology and keeping up with that, and then figuring out how to retrofit what you're doing to whatever new is happening. I think that is always complicated, and so you've got to have a team that you can work with who understands that and helps kind of synthesize that change. And then the other thing that we're really dealing with right now is then how you back up what we're trying to do with all the amazing technology that's out there into HIPAA and security. And, understanding, what can we do and what should we do and how can we leverage it in the best possible way without also the potential of a lawsuit or legal issues related to the kind of control over security and so forth. So that has been a huge challenge for many of our clients this year. It's amazing to me how many hospitals and healthcare systems this last year have had to deal with that and either take things down from the website or change the way that they're doing certain things because of laws and rules and concerns internally. So a lot of organizations are dealing with that right now, and I feel like that's kind of one of the big things. And that kind of jumps back into the whole thing with AI and I think ChatGPT, is that there are so many fantastic new opportunities that come with those tools. And then there are also so many mythological concerns about what they can do and how invasive they can be. So there's fear based out of, I think, lack of knowledge. And that's one of the great things I think about a conference like this and podcasts like the kinds of things that you guys do, is clearing some of that up and helping folks understand how they can move through this new environment, and also still be able to reassure internally their senior level leadership that this is all safe and good, and there are a lot of things that they can do to leverage the technology without worrying about concerns for security. And those are some of the topics we'll be covering at the Healthcare Internet Conference.
Mike,
Great.
Let's take a deep into the future now. As we look ahead, what are some exciting changes or additions that we might expect to see even next year at HCIC 2024?
Yeah, as time goes on, we get even technologically more advanced. So we're always trying to incorporate better ways to allow folks to navigate the conference. So I see improvements in the way that we leverage our app, in the way that that it's interesting. We would love to record and video and archive every session, but it's complicated, it's expensive, it's difficult to maintain, but I see those barriers coming down. So I don't know that it'll be next year, but in the future, at conferences, I think it's going to be a lot easier to re-access content that, you can't, in my opinion, I don't think you can substitute face-to-face with online, but I think you can reinforce with online. And so it's great to be able to sit in a session and then go back and look at it again. So I'm hoping that, we'll see those barriers come down and we'll be able to do some of that in the future. I see AI and ChatGPT being an important growing part of all of this, and how organizations are being impacted by those kinds of technological features. And in this year, we're learning about it. I see the industry kind of trying to embrace it, but we're neophytes when it comes to utilizing it. And so what I think we're going to see next year is real progress. Like I think next year we're going to be able to have empirical evidence that says, here's how we used it, and this is what we learned. These were things we decided not to do, and these are things that we found were really fantastic about it. So I do think that we're going to see some growth with that in the next year.
Interesting. So next year we'll probably see more best practices around implementing and not just philosophizing about AI and
Correct.
Generative. Amazing.
Exactly.
Wow. Well, we're excited to be a sponsor every year now. We are looking forward to meeting you guys in person in November. Any last words for attendees listening in or vendors listening in that you'd like to share?
I think two things. One is operationally, make sure you get your hotel room. That's one of those things that sometimes people do at the last minute, and sometimes the hotel rooms are gone. And so I know that we're going to have a big conference this year. We're already ahead in terms of attendance and vendor participation. So jump in there as quickly as you can to make sure you secure your reservations in your room and all of that good stuff. And then I would say plan. We're in LA. It's a great venue. I've been there a couple times now. It's connected to a thing called LA Live, which is a bunch of restaurants restaurants and fun places to go out. And so you're all contained in one particular area. So if you have the opportunity, it's a great opportunity to come in a little early or stay a little late, have some fun, make your plans, make sure you do a little mix of business and pleasure. And the last thing, and maybe this is the most important, is make sure you leverage the networking, because you don't get many opportunities to be around a bunch of people who are all in the same industry that you can sit down face to face and have conversations with. So do your best to try and, maximize that networking and meet with people that you can really connect with and learn from.
Oh, well, now I have FOMO that my team's going without me, but hopefully
we'll see you next year. Yes,
Absolutely.
Exactly.
Well, Mike, it's been a pleasure. Thank you so much for putting together these events for the community, and I'm sure we're going to learn a lot, and I can't wait.
Great. Thank you, Leah. I appreciate the opportunity. And we look forward to seeing your team at HCIC.
Yes, you will. Thanks so much.
Okay. You bet.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.